psychoactive substance is a substance which causes the brain to act differently. So thereby it can change the way we think, the way we do things, and the way we feel and how we act. What are the psychoactive substances that we know? Alcohol, heroin, then cannabis, which we are talking about today, is also a psychoactive substance among the others like amphetamines and so on. So why are we talking about cannabis these days? Cannabis, which has been used for many years, has now again come into play. We might have been using cannabis for various things in the past, but that does not mean that with increased evidence about its harmful effects on the mental health and the physical health, why do we have to use it still? We don't continue to do things which we have proof against, isn't it? With the times, with increased scientific evidence, we need to change our thinking pattern. Similarly, with cannabis, unlike in the golden old days, we have evidence to say that it can increase the risk of getting schizophrenia, and it has an impact on the way we think, and we are made to be less motivated to do things, and our mood might change simply because of using cannabis. And the most of the impact of cannabis use is not for the people who are older. Yes, they can be using cannabis, but then the youngsters, the youth is affected most. And there is scientific evidence to say the more cannabis you use, the stronger the type of cannabis that you use, and the younger the age of onset of using cannabis, the repercussions, the bad effects of cannabis are going to be more. We are at a time where the medications that is given for psychiatric disorders have evolved, and the outcome, the quality of life of patients with severe mental disorders like schizophrenia has become very good. And there is evidence to say that if you are using cannabis, not only the risk is increased by about 6-fold, the outcome is also going to be poor. So while making the lives of the mentally ill better by allowing cannabis to be around, we are making not only the people with mental illness, but the normal youth to be sick. Once upon a time, yes, we have used it for many things, as I mentioned earlier, but I'm emphasizing again, there's evidence to say not only in the mental health, but the physical health aspects like the respiratory system, the cardiovascular system can be affected because of cannabis use. Not only that, your driving will be affected. You would not be able to drive properly simply because of cannabis. Similarly, with cannabis, there might be some use as a medication, but that does not warrant, or that does not mean that it needs to be legalized, just like opiates. I'm sure nobody is going to say that just because it can be used as an opiate, which we use as morphine, that it needs to be legalized to be used among the normal population, isn't it? So just like that, there can be some uses, but that does not require that particular substance. In this instance, cannabis needs to be legalized to be used freely among the people, jeopardizing the health, physical and mental health of the people, particularly the youth. So there are different mechanisms in place to take care of that. So let's not worry about that, and let's safeguard our people, our youth, from this unwanted psychoactive substance which is cannabis.